Hi everyone, today's video is on vitamin D. Thank you so much for your response on the video which I shot for vitamin C. I really did not think that the response would be so much on Instagram, Facebook, YouTube, everywhere. Thank you. And then I got many comments and many messages saying or asking me to make a video on vitamin D. So I researched almost 3 days on the same topic, which was vitamin D, continuously to make a really crisp and really informative video for you guys. So let's get to it. Vitamin D is very closely related to immunity, and that's why we are building this video. The first one is benefits of vitamin D. What are the benefits? Vitamin D increases calcium absorption by 20 times. So it's a very important vitamin if we look at calcium absorption or uptake of calcium. Your immunity increases a lot, and especially when it comes to respiratory virus, the fighting ability of the body or the immune response of the body increases a lot. It helps the immune system a lot. It's a pro-hormone, which means vitamin D is a precursor to a hormone. So it's a pro-hormone, very important vitamin. It reduces chronic pain. So many of our members actually complain of chronic pain when they have pain in their joints, when they feel tired or fatigued all day. So it does reduce chronic pain, and it improves the quality of your sleep. These are some benefits of vitamin D. Should we consume it or not? Whether you should consume vitamin D or not is decided by two things. One is your blood tests or your blood markers, and second is your doctor. So your doctor would prescribe you vitamin D supplements or vitamin D injections if your vitamin D is very low, especially if it's lower than 30 mg per deciliter. This is the unit of vitamin D in your blood. It is always better to have vitamin D in a divided dosage. Please remember that divided dosage means a daily dose rather than a weekly dose or a bolus dose where you get a lot of vitamin D in one go. So divided dose is always better. Again, this is not my opinion. I am linking down below a meta-analysis, a scientific study. A meta-analysis is actually better than a research paper because in a meta-analysis, they combine the statistical analysis of various studies, of many studies together. So it is given in a meta-analysis that divided dosage works better. It should always be consumed with vitamin K2. Vitamin K2 does the same or the similar role of vitamin D, which is that it helps in uptake of calcium. So better if we consume it with vitamin K2. The best form of vitamin K2 is MK7. One more interesting thing about vitamin D is that it is produced or manufactured in the body with sunlight, of course, but the precursor of vitamin D is cholesterol. 7-dehydrocholesterol is the molecule. So the cholesterol, which is a very important hormone in the body, many people who have very low cholesterol do have problems with vitamin D. So cholesterol being low is also a problem for the human body. Whenever you go to buy vitamin D in a pharmacy, please remember the unit of vitamin D that the doctor has prescribed you. Vitamin D comes in two units. One is IU, which is international unit, and the second is mcg, which is micrograms. So if your doctor has written down 60k IU, which is 60,000 IU, please do not go and buy micrograms because 1 microgram equates to 40 IU. So whenever you're buying vitamin D supplements, please check what the doctor has prescribed for you. Cholecalciferol or vitamin D3 is the form of vitamin D which has highest bioavailability. So whenever you go or buy supplements, check for this form because this is the most bioavailable form. Let's look at rich sources of vitamin D. Fatty fish, eggs, whole eggs of course, cheese, animal liver are good sources of vitamin D, but the best source of vitamin D is sunlight. Which means when you are exposed to the sun, the body converts again 7-dehydrocholesterol to vitamin D with the help of your liver and your kidneys. Pigmentation is a very important concept because for dark skinned people it is more difficult to absorb sunlight in order to convert cholesterol into vitamin D. That is the primary reason why people actually started turning white. If you look at the northern hemisphere, the exposure to sunlight is very low. So in order to absorb the sunlight better, the skin of human beings actually started turning white. For anything related to evolution, I always read this book called as Sapiens. It's a very interesting book, you can also give it a read. Deficiency of vitamin D. What does deficiency do? It increases the risk of viral infections. It is very, very relevant to the current condition of coronavirus. So please check your vitamin D levels, and if they are not in place, ask your doctor what is the best step or what is the best supplement to be added in your whole protocol. It reduces bone health. It increases risk of cancer. It increases tiredness. Now tiredness is something which is very interesting because we have got many members who have had their nutrition exactly on point, who have had their exercise exactly on point, and then they came to me asking, why am I feeling so tired all day? When we investigated their blood, when we saw their blood reports, we found out that vitamin D levels were super low. And as soon as vitamin D was prescribed to them, the energy levels started increasing, their work performance got better. So if you are feeling tired, please give a check to your vitamin D. Depression. Vitamin D is very, very closely related to depression. Again, linking down one more study where how many depressed people have actually low vitamin D levels, and it reduces your healing process. Again, vitamin D is a very, very important immune modulator. It plays a very important role in your immune system. So low vitamin D levels will reduce your process of healing or your process of recovery. Toxicity. Now we spoke about vitamin D, we spoke about the amazing benefits of vitamin D. So it is not right for you to go out in the pharmacy and then to start popping in pills of vitamin D. Please remember that it can get toxic as well. It is a fat soluble vitamin, so it stays in your body for a long time, not like vitamin C or B, which are water soluble. So vitamin D can get toxic, and when it gets toxic, you can get affected by hypercalcemia, which can lead to kidney stones or excessive urination. So before taking any supplements, it's a request from my end to go and check it with your doctor. So that was all about vitamin D. Please let me know what other topics you want me to cover in this scientific way, and be safe and be indoors. Thank you.